السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 33 in maternity and newborn nursing. Today we are going to discuss 5 questions from question number 214 up to question number 218. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 214. The postpartum nurse is assessing a client who delivered a healthy infant by cesarean section for signs and symptoms of superficial venous thrombosis. Which sign should the nurse note if superficial venous thrombosis were present? The options are number A, painless of the calf area. Number B, coolness of the calf area. Number C, enlarged hardened veins. Number D, palpable dorsalis medius pulses. وقفوا الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number C. اللي اخترنا الخيار رقم C نشوف rational. Thrombosis of superficial venous usually is accompanied by sign and symptom of inflammation, including swelling, redness, tenderness, worms of the involved extremity, and also possible to palpate the enlarged heart vein and sometimes experience pain when they walk. So the correct option is option number C. Palpable dorsalis medius pulses is normal finding. The remaining options are incorrect. Question number 215. A client in a postpartum unit complains of sudden sharp chest pain and dyspnea. The nurse notes that the client is tachycardiac and respiratory rate is elevated. The nurse suspects a pulmonary embolism. Which should be the initial nursing action? The options are number A, initiate an intravenous line. Number B, assess the client's blood pressure. Number C, prepare to administer morphine sulfate. Number D, administer oxygen 8 to 10 liters per minute by face mask. وقف الفيديو هنا واختار الخيار شو سي. The correct option is option number D. اللي اخترنا الخيار رقم D نشوف rational. If pulmonary embolism is suspected, oxygen should be administered 8 to 10 liters per minute by face mask, and the client also is kept on bed rest with the head of the bed slightly elevated to reduce dyspnea. So the correct option is option number D. Morphine sulfate may be prescribed for the client, but this would not be the initial nursing action, and also intravenous line will be required, and vital signs also need to be assessed or monitored, but this action will follow the administration of the oxygen. Question number 216. The nurse is assessing a client in the 4th stage of labor and notes that the fundus is firm but that bleeding is excessive. Which should be the initial nursing action? The options are number A, record the finding. Number B, massage the fundus. Number C, notify the healthcare provider. Number D, place the client in trembling back position. وقف الفيديو هنا واختار الخيار بالشيء صحيح. The correct option is option number C. اللي اخترنا الخيار رقم C نشوف rational. If the fundus is firm and bleeding is excessive, the cause may be laceration of the cervix or birth canal. Therefore, the nurse should need to notify the healthcare provider for repair. So the correct option is option number C. Massage the fundus if it is firm will not assist in controlling the bleeding, and the trembling back position should be avoided because it may interfere with cardiac and respiratory function. Although the nurse will record the finding, but the initial nursing action will be to notify the healthcare provider. Question number 217. The nurse is preparing to care for 4 assigned clients. Which client is at most risk for hemorrhage? The options are number A, a primiparous client who delivered 4 hours ago. Number B, a multiparous client who delivered 6 hours ago. Number C, a multiparous client who delivered a live baby after oxytocin induction. Number C, a primary vasculine who delivered 6 hours ago and had epidural anesthesia. وقف الفيديو هنا اختار الخيار اللي بتشوفه. The correct option is option number C. اللي اخترنا الخيار رقم C نشوف rational. The causes of postpartum hemorrhage include uterine atony, laceration, hematoma, and retained placenta fragment. In addition, many predisposing factors such as history of postpartum hemorrhage, placenta previa, placenta abruptia, and overdistension of the uterine, and many others. So, the multiparasculine who delivered a large fetus after oxytocin induction has more risk factor associated with postpartum hemorrhage. So, the correct option is option number C. There are no specific data in the client description in option number A, B, and D that present the risk for hemorrhage. Question number 218. A postpartum client is diagnosed with cystitis. The nurse should plan for which priority action in the care of the client. The options are number A, providing cytospas, number B, encourage fluid intake, number C, placing ice on the perineum, number D, monitoring hemoglobin and hematocrit level. وقف الفيديو هنا اختار الخيار اللي بتشوفه سي. The correct option is option number B. اخترنا الخيار رقم B نشوف rational. Cystitis is an infection of the bladder. The client should consume 3000 ml of fluid per day, 3 liter, if not contraindicated. So the correct option is option number B. Cytospas and ice would appropriate intervention if a perineal discomfort has occurred. And hemoglobin and hematocrit level would be monitored with hemorrhage, not with cystitis. So the correct option is option number B. Encourage fluid intake. شكرا جزيلا. نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.